half the children born today in the so-called rich world will live 100 years. How does that change almost everything?
We have an astounding problem in this country. It's going to create the urgency for us to make change in this system of serving our seniors.
A lot of these shifts and a lot of this need for collaboration is inevitable because of the sheer demographics and the aging of the country. To put it simply, our healthcare system is inefficient. We spend a lot but do not get the reciprocal value out of that system.
This is not really a national conversation. And yet, because of the size of what's coming at us, it really should be. So policy and advocacy is one of the things that really came out as important. Improved interaction between housing and healthcare in relation to policy, rules, regulations, really to facilitate the long-term viability of affordable senior housing.
It's critical for Atlanta in terms of the number of folks. I think there's probably 6 million people in the 28 county metro area. And by 2020, 2025, 20 or 25% of those people will be 55 or older. And I just don't think we're prepared for it. And I don't think people realize the opportunity that lies in front of us.
When there's a political will, there is a political way. And so I think we really need to push to make this a political conversation. Could this be one of those topics that is put on the debate schedule? I mean, why isn't that something that's being asked of the presidential candidates? Why wouldn't we want to know, what is your plan for how to really deal with the graying of society? Do you have a vision? When we get serious about an issue, we can make things happen.
So we began to think we've got to change the momentum in our communities so that we can be a place where people can live throughout their lifetime. We said, how could local governments make it easier to build the kind of housing that we know that older adults need? And it's not just affordable housing. Affordable housing out in the middle of nowhere is no good for anyone. So to build the kind of communities we know that people need, no matter their age, but particularly as they age, we have to change. And change is really hard. It turns out that communities sometimes resist change when they don't understand it.
There has to be strategic commitment from communities. And lots of times folks will say, well, yeah, it sounds good. I'm not sure I necessarily want to commit to that in my neighborhood, in my community. So I think part of that is just education in terms of what a National Church Residences development looks like, how that actually improves the quality and vitality of your life to make it a destination place that you actually want to be, not a default place that you end up.
You're going to need the assistance of other players in your community, other healthcare providers to take care of these folks. And you're going to need to think about this person holistically, not just think about they have diabetes, they have CHF, they have all of those things. And so you need to think about them holistically, and you need to have partners that can help you care for them in that way.
What is the biggest fear that seniors have? It really isn't of death. If you look at a recent survey, their biggest fears were loss of independence, declining health, and guess what? Running out of money.
I enjoy my life because I have my health and I can do things. I want you to start thinking about what do you need to invent your business, and then let the engineers deliver it. Technology, or real innovation, is about putting practical ideas into use. And at the end of the day, remember our friend Sarah Noss at 119 years old, I have my health and I can do things. Can you deliver better outcomes?
You know, often we create programs, but do we really know what people need? And so to what degree do we actually understand what they need rather than pushing programs at them? And the opportunity associated with actually spending time with family members as well as the patient and making sure that what's actually being designed is something that they actually care about and that they would value.
In 1930, 70% of physician visits were in the home. The home provides a fantastic way to really understand patients, to understand their environment, and to address things at their root. All of that technology can allow us to bring care back into the home. And there's been a whole host of delivery innovation around the home that really gives us the chance to potentially go back to the future and really deliver care much closer to the patient.
There are many of us now focusing on this better care at lower cost and better outcomes. It's really important. But interestingly enough, organizations that have focused on healthcare are suddenly increasingly interested in affordable housing as part of that incredible ingredient. How exciting. Safe, decent, affordable housing is now a huge impact on how long a healthy senior will be able to stay out of expensive care settings.
It's not about fixing disease. It is about promoting well-being. And if we're going to be patient-centered in our care, we have to understand that well-being is different for every patient.
In order to enable all of this to happen, it starts with you as leaders. And so from a leadership perspective, it's all about communicate, envision, and inspire. Hear, understand, and implement, and create transparency for all.
We need passionate leaders to really work together in partnership on these serious issues that are facing our senior population. It could be overwhelming if we tried to do this alone, but with partners we can make things happen.
Who are the leaders? Defining who they are. And there are a lot of leaders. There's community leaders, healthcare leaders, corporate leaders, political leaders, and they all need to work together.
Educating folks on that, making them aware of it, collaborating with them so it becomes a joint initiative, not our initiative. And in so doing, the city of Atlanta maintains its vitality.
All truly great leaders are servant leaders because they serve the people well and the followers know the difference.
And for leaders to have the air of a servant leader takes a tremendous amount of emotional and character muscle. And so as we think about all of our roles here in building the next generation of leaders, of people that are around us, they've got to feel the consequences of choices and decisions they make.
The defining outcome of the servant leader is trust. It's your measure, it's your test. The purpose of the servant leader is contribution.
We develop our better ability to perform by learning from either where we got it right, which we don't always do sufficiently, but also from where we got it wrong. And again, it requires a cultivation of humility to recognize that I don't know everything.
We manage things, but we should lead people. People don't want to be managed, they want to be led.
There was another action that was brought up, and I loved it, and that was support for the supporters. If you've been in that role or in that role of supporting a parent or an elderly person, what do you need as in that role?
You know, the truth is we daydream about how we could make this dialogue everywhere. This isn't National Church Residences dialogue. This is the nation's dialogue.
We need housing and we need innovative support services. Let's all work together and find solutions that will ensure our seniors, all of them, will have enough resources to age with dignity and respect.